we had a cat at the clinic that was seizuring 5 times a day. He was 18 years old. And so the regular vet was going to euthanize the cat. And we ended up, well, the client and I just kind of came to this thing like, let's just try CBD because we have nothing else to lose at this point. And do you know that cat is still going? It's been like 2 years, no seizures. So, this is a dog that's had epilepsy. He at one point was seizuring every day.
Multiple times, up to 5 times a day.
Let's see. This is a long time ago, so we can talk about it. But he's had multiple he's had neurologists, he's had MRIs. He at one point was on 4 different medications for his nervous system to calm the seizures. Okay, so I want to introduce everyone to one of my favorite people of all time. This is Dr. Robert Silver, and he almost needs no introduction because, and especially in our world, because he has kind of become, you have kind of become the CBD and even the mushroom, like one of our just experts in the field. And boy, it's just going to be, it's huge. It's just so much information to get out there to people. And I kind of wanted to talk, I thought it'd be fun for people to learn about our ages, so I'm 54. I'm fine telling people, I don't care. Um, I'm 50. Yeah, I know. Oh, I think I'm not a baby, but but
Well, not a baby in that regards, no.
no, but it's all a testament to holistic medicine. And you are 73, you just told me, which is shocking.
Well, in another 3 or 4 weeks, yeah.
Wow, happy birthday. But we were just talking about our own healthcare. So you drink a custom Chinese herbal tea every morning, is what
I
you
do.
do.
I do. I've had a number of chronic disease challenges, as I think we all do,
Yeah.
our own challenges that are specific to our lives. And so I adopted the use of this particular formulation 5 or 6, 7 or 8 years ago. I'm not quite sure. And it, amongst other treatments, had a nail bed psoriasis. It ate away my nails in the nail bed. I couldn't play guitar, couldn't do procedures medically anymore, could barely even type on the keyboard. It was really awful to watch because as vets, we're so used to using our hands for
Yeah,
everything.
hands are everything.
And if you're a musician, even more so, it's an
Mhm.
expression. So that was really a difficult time, but I managed to bring it into remission, and I credit the Chinese herbal formula as being part of that. Very strong with a lot of the Chinese herbal turmeric types of individual herbs.
And did you cure the condition altogether or kind of control it? Like what's
It's in almost complete remission now. I get
nice?
little things on my nose and top of my head and stuff, but the fingers are good. I can play the guitar again. It's very cool.
Wow, that's
I didn't
huge.
practice. I could probably do some procedures, except for the arthritis in my fingers. So maybe I look young, but inside the body is
Well,
still.
it's tough. As we age, I always say aging is not for wimps.
No, it's
And for our
no,
animal friends too, that's very true.
no.
Well, let's get to the animals a little bit. So we were talking about, you have a company where you sell CBD products and some mushroom type products, and I think people would love to hear about it. And you told me one of the products is called Silver Bullet, the strong CBD product for pets for pain, and probably we'll talk about other conditions that it might treat, and then maybe a little softer one for cats called Sterling Silver, which I love that because it uses your name. It's so clever.
Playing all those silver names.
I know. I wish my last name were Silver or Gold or I don't know, something, but instead it's something no one can even pronounce. But anyway,
Yeah.
what's the name of your website and tell us a little bit more about it?
It's called Well Pet, all one word, dispensary. Well Pet Dispensary, just like it
Great.
sounds, .com. And when I sold my practice in 2010, and I pretty much practiced for another few years, and then I was looking for something else to do, and I didn't want to stop helping the critters. So, and I'd spoken to a couple of other vets who had done something similar, where they'd set up a little kind of a pharmacy, of supplements that they were used to using in their patients that they're then offering online. So I had a lot of success using these supplements in my practice in Boulder, Colorado. So I set up this website, and I also set up a blog site as well. I didn't tell you that one. It's called nurseyourpet.com. And I actually co-authored that blog site with Joyce Harmon, who's an equine herbalist and integrative veterinarian, and then Gabby Varco, who is a rehab specialist out in California. So it's a really nice little blog site. But anyway, so I wanted to provide the benefits to the critters that I was doing in practice now that I wasn't in practice anymore, because my career was changing to work with companies to develop good products for the pets and for the vets. So I started selling some of the products from RX Vitamins that I had formulated over the years, and products from other companies. And then the whole CBD thing came down, where CBD was finally legal for us to be able to sell it online. And there was a huge amount of public interest in it. And at that time, I became one of the few veterinary experts in that area. I know how to help people with dosing and what particular products to use, and even THC, which is not kind of a no-no for veterinarians, but people are out there in states like yours, like Wash State or Oregon, where they can walk to, all you need is a 21 and over ID. You can walk into any dispensary and buy some stuff, give it to your dog, and send them straight to the ER. And there's no instructions out there, and the state boards don't allow the veterinarians to really discuss it, which is the stupidest thing I've ever heard. So someone's got to do it, and I'm not in practice. I'm licensed, but if I write a book and they say, hey, we're going to take your license because you wrote the book, well, to heck with them. I'm going to write the book anyway, because this information needs to be out there with the pet owners so they can do it safely and effectively. And there are places where THC can be helpful, but for many things we don't need THC. We can get by with CBD.
Well, that's awesome. Let's talk a little bit. So just for the basic, for people who don't know anything about CBD products for pets, what are just some basic uses for them, just in general? And then we can break it down into, what you're talking about with the THC versus the cannabinoids type discussion.
Oh, cannabis, the Swiss Army knife of supplements, because it has so many different ingredients in it, all of which have different actions in the body. And the reason why cannabis and CBD have so many effects is because they directly signal, they directly interface with, they directly stimulate a system of receptors and molecules in the body that are responsible for creating balance and harmony, something that we use the medical term homeostasis, but it's basically balance and harmony. It keeps the body running in a healthy way, and the system that CBD activates is that system of homeostasis in the body. So we have these receptors that the CBD interacts with in the nervous system, in the immune system. So we get to see improvements in reductions in inflammation. We tend to see reductions in anxiety, because it also affects the nervous system in that way. We can tend to see reductions even in histamine release, because that's another receptor that CBD signals. We also see a direct effect on cancer cells, because cancer cells have receptors for cannabinoids like CBD. It's a little more complicated than that, but that's simplistically how it works. So commonly we think about using CBD for mild to moderate painful situations, like maybe after strenuous exercise, on an intermittent basis, or with chronic painful issues like hip dysplasia or generalized arthritis in the dog. It can help with that. But a lot of people have come to think, with all of the hype on advertising, that CBD could do anything, and it's a cure-all for anything at all. And the reality is it really does have a lot of effect in a lot of different systems, but not every system all the time in every animal. And sometimes it's a dosage issue. Sometimes you need to use a lower dosage to get a better effect. Sometimes you need to use a higher dosage to get a better effect. It's very interesting the way it works in the body. Sometimes if you have excessive amount of body weight, you may need to have a higher dosage because it gets sucked into the fat and doesn't get used up in the body. If you've got a serious condition, like if you've got bad arthritis and it's so serious that you're using a drug to help with it and the drug's not working, well, CBD might work, but it might not work because it's so severe, it needs more than that. In those cases, we look to use small amounts of THC, but THC can be difficult because dogs, for some reason, have uber numbers of receptors for THC in the back of their brain. So when dogs get THC, they develop these neurologic problems where they start to kind of get unstable and and very uncomfortable not having control over themselves. And so that's the biggest problem with THC. It's not toxic in the sense it's going to kill them. We really haven't had any dogs die of just THC poisoning, nor have we had any humans die of THC poisoning, except if they give the THC by injection with a syringe at dosages that would be impossible to recreate in nature. So I don't know if I'm answering your question or not, because I tend to
No, you're good. I know it's amazing. You're like
lot of
just a knowledgeable everything. Well, one thing I was going to say is about those cases, at least the ones I've seen, is they have like sort of a 24-hour, if they get like, say the old days where they just got into the, kids pot that was on the coffee table or whatever, and they would eat the whole thing, which is crazy. And I don't even know what the THC count, like, or this level and like an ounce of, the old school marijuana, because most of the products now are not that way. They're, oil based, or, all the animal products that, I mean, you speak more to this, but that it doesn't go on forever, the hyper excitability that the THC causes. I mean, most of the time, I just remember when I worked emergency, we'd have them in a dark room, and we'd support them with fluids and things like that, but it was very, it would wear off, I don't know if that's what you've seen.
for most dogs, it's relatively controllable, and I
Yeah.
used to joke, I'd say, oh yeah, just, light a candle, burn some incense and put on some Jimi Hendrix, and they'll be fine, give them a couple of, biscuits to eat and they'll be fine in the morning. But there are some dogs that
Some dogs.
get an excessive amount. There's one story in one published paper about ER visits for dogs that was published in Colorado back in 2012, where they had a little skipper key, a little 8-pound skipper key, and consumed an 8x8 tray of brownies that had a full ounce of marijuana in it. Now, if you've got an ounce of marijuana that maybe has 15% THC, that's a lot of milligrams. That's
Plus you have the chocolate too. It's like, what?
well, the co-toxicity with the chocolate, I think, is why this dog died. Because we do see deaths, but they're never from THC alone. Usually there's chocolate involved, or macadamia nuts, or less commonly raisins or grapes, So yeah, so CBD has a lot of value, and I think that it's potentially a very good therapeutic for many animals because it is safe and it does work. It's a little bit on the pricey side. I think over time we're going to see prices go down even more than they have. They are going down. It used to be it would cost $30,000 for a kilo of CBD. That's now down to like 3,000 to 4,000. So the prices have gone down substantially in the last 6 or 7 years, and that a lot of that's reflected in consumer products. So I have this website and it's doing pretty well. We've got a lot of really loyal customers because I also try to give some advice. I can't really give medical advice, but
Yeah.
people want to know about product selection. I can ask them what's going on with their animal and guide them in the right direction and help them with dosing. So we've done really well. And because I have a lot of expertise in CBD and in cannabis, I wanted to create my own product line that would be, in my mind, a really good thing to have for pet owners.
Well, I was going to just tell you clinically, what I hear from clients a lot is that, like, say they have an old dog that has hip arthritis, we just mentioned that, or back pain or something, and they're like trying to get away from conventional medicine. So with the CBD that they could get, like, say at our health food store, at our doggy health food stores that are around here, a lot of people say they don't do anything. Like, I hear that all the time. So then I end up going into like acupuncture. And I mean, that's one reason why they come in, they're open to it, but it isn't as effective as they had hoped. And so I wondered if you could speak to the quality, because like, and to me, those products, a lot of the products that are out there are just basically like hemp oil, like they don't seem that potent at all in terms of their effective, no matter what the dose is. And so how does that relate to like the products that you sell, or maybe some other products that you think are good? Like, what are you actually looking for in there?
Well, that's a really good question. And, just holding a bottle up, there's no way of knowing what's in there. And even if you look at the label might fib a little bit because because there is, amongst some companies, there's not a lot of integrity to make that buck. So there are standards of labeling that
Mhm.
companies should follow, but
Mhm.
the best way for a consumer to learn what's in a given product, it's a little time consuming, but the only way to do it is you call the company and you say, hey, I've got this product in hand. It has this lot number. Usually in the bottom of the bottle it has a little lot number for the manufacturing batch, which links back to what the actual original active ingredients are that go into it. And you ask them for what's called a certificate of analysis. And this is a laboratory analysis of the potency of the product that'll tell you how much CBD it has in it, how much THC it has in it, and how much of the other active cannabinoids does it have, like CBG or CBC or CBDA, this alphabet soup of all these cannabinoids. Each one has similar but different effects than the other. So
Mhm.
that way you get to know what's in it and how much is in it per unit milliliter or unit gram. That tells you it's got potency or not. Yes, many products use hemp seed oil because Google's not going to shut them down for selling hemp seed oil, whereas Google will probably shut them down for selling CBD. And the consumer doesn't know the difference. Hemp seed oil is way cheap. You can buy it anywhere.
I was going to say, I think it's at our local health food
Got some
store.
omega-3s and it's got some benefits, but it has to be given over a long period of time and not nearly as much of a benefit as something like CBD would have.
Mhm.
So I don't like that they do that.
Mhm.
So that's another reason why I set up this my own products, because I feel people can trust what I do.
Mhm.
I put my name on the product. I've branded the products. It's Doc Silver Naturals. So I'm very proud of it. And it has my integrity and my reputation part of it. So you can be sure that what's in there, what's on the label is what's in the bottle. We
Mhm.
provide third-party certificate of analysis to anyone who requests it
Mhm.
on any of our products that have CBD in them, so
Mhm.
people can decide for themselves what they want, what they don't want. There's other things that are in cannabis other than cannabinoids. There's terpenes. You know about terpenes, if you're an herbalist, because so many herbs have these volatile molecules that have a lot of activity. Flower essence, not, I'm sorry, essential
Essential
oils
oils,
are
yeah.
basically terpene, blends of terpenes that are naturally produced by each herb or by
Mhm.
each flower. So the terpenes themselves have a lot of biological activity in the cannabis and interacts. We have some studies that show synergy between CBD, let's say, and beta caryophyllene or linalool, or limonene, any of these major terpenes that have very strong effects on the nervous system, the nervines. So many of these certificate of analyses will also tell you what terpenes are in there as well. Now, the good side to terpenes is they work synergistically with the cannabinoids to make the product more potent. And depending on the terpenes, if it has a terpene called myrcene is found in hops. It's also found in mango, and it makes you kind of sleepy and sedated, and it helps to treat pain. If your product has a lot of myrcene in it, they might think that the CBD is sedative, but it's not.
Mm.
CBD is not sedative. It's the myrcene or the THC that's doing it. If they have, linalool in it, which is from lavender, and they use the CBD, it could be helpful for anxiety. So lots of times, if you look at the certificate of analysis, it can give you an idea of whether the formula would be good for anxiety, let's say, with linalool, maybe, and some limonene from lemon, which is kind of antidepressant and elevating, or maybe for pain with something called beta caryophyllene, and maybe extra CBG on top of the CBD. That's what I did in my formulas, is I put half as much CBG as CBD, so it's got those two cannabinoids. And there's studies that show that CBG is actually 10 times or more anti-inflammatory than CBD in the same
Nice.
solution. So by putting the two together, you get a broader spectrum of activity. You still don't get any psychoactivity or intoxication with it. Plus, I used a carrier oil in these tinctures called medium chain triglycerides, which is basically like coconut oil, but a little.
Yeah, and that's great for me because it's low allergen. I have so many allergies to the fish oils and all the other, carriers, especially in treats, because I do muscle testing and I focus on allergy testing. And, so it's like anything with wheat, anything with gluten, anything with egg or chicken tissue, actually any animal product at all. It's like, oh, maybe the dog wants to eat it, but it's not gonna, there's gonna be inflammation from the actual carriers. So it's great to coconut oil. I've only seen one allergy in all these years to coconut oil. It's a German Shepherd. It's
These
like,
are,
look,
yeah,
but
and these are organic too. So sometimes
nice.
you're not allergic to the actual material, you're allergic to some contaminant in it, you know.
Yeah, could
Plus,
be.
plus the medium chain triglycerides, which is what the coconut oil is, are very bland. And so we've learned that you get the best blood levels with CBD if you give it with food. So for cats, which are a more difficult species to medicate than dogs and horses, let's say, cats are very suspicious about getting
Yeah.
dropped in the mouth. They're very resistant to that. You put drops in their food, they're resistant to that as well. With this, they are less resistant. Can I say all cats are going to take it? No,
Yeah.
you know,
But
but
no,
many,
that's great.
putting it in some food that's tasty, some dried food, will also improve blood levels and be more likely to actually get it down.
What I wanted to ask you, Rob, is about cats because we have this whole sort of pharmacy of pain drugs that the veterinary industry is pushing now, and they're kind of doing it in a way like I don't like it because I mean, we went from one extreme when I graduated from vet school in '94, where we had no pain drugs, to now where it's like gabapentin goes in every animal, and I'm not even actually sure it's that great for pain. I think the CBD products are much better, but let's talk about cats for a second, because even with cats, I think the CBD products are probably so much more effective and actually so much safer for cats. And I guess just a specific about cats is they don't have the liver enzymes to break down a lot of drugs the way that dogs do. And so that's why they can have liver problems and kidney problems secondary to pharmaceutical intervention, especially chronic pharmaceutical intervention, which is why I do acupuncture and stuff for their arthritis. But as far as your input or your thoughts about CBD specifically for cats and what you've seen and kind of how you developed your formulas, have you seen that sort of a diversification in the cannabinoids? Has that made a difference with treating pain for cats?
Even cats can be treatable with cannabis,
Mhm.
and it can be treatable very well. But it's the same considerations that we look at with dogs, which is proper dosing and dosing. And I really didn't talk specifically about dosing from your prior question, so I should go into that bit. But let me finish with the cat topic first, which is that they have to be dosed properly. They have to get it. It has to get into them. And twice daily is what we think cats need based on the existing studies, just as dogs. Horses could probably be once a day. People could probably be once a day, but you can get higher doses by giving it twice daily versus having to give a whole bunch at once. Um, so cats will respond really well. They'll respond to CBD. They'll respond to CBG if their condition is something that responds to it, and sometimes with pain, it's more than just arthritis, inflammation. There may be some other things going on as well. And THC is another good cannabinoid to add to the mixture to treat the pain. And cats are, although they are sensitive to THC, not nearly as much as dogs are. And so they're able to tolerate larger amounts more rapidly. And you mentioned, that in the ER, the dogs would have their problem and then get over it. What we find is that when dogs or cats or humans are exposed to cannabis, any of the cannabinoids, regularly over a period of several weeks, they develop a tolerance to some of the adverse effects of THC, like the psychoactivity. This is one reason why people who smoke pot recreationally oftentimes have to find more powerful strains or have to smoke more because they don't get the same feeling that they did Well, that's a good thing when we're trying to medicate with THC, because if we start with teeny amounts and give teeny amounts for a couple of weeks, we can then escalate the dosage to be enough to remediate pain, but not so much that it makes them loopy. It's a delicate balance, and it really needs to be done by a veterinarian. And that's what pisses me off about these state organizations that keep the veterinarians out of the conversation. We're the ones that need to be in the conversation, because we know how to moderate dosing, especially for herbs where we don't have precise dosing guidelines. We dose to effect. We start with a lower dose and we gradually ramp it up till we get the right effect, because we also don't want to have that cat vomiting on the carpet, with a whole bunch of stuff on that first dosage. So cats are good. Yeah, I think it's a good solution for cats who have that potential toxicity with NSAIDs in their liver and their kidneys. Absolutely. And it can help quite a bit. I also would say that for cats, one of the things I found to be very effective were the sub-Q injections of adequate, sub-Q injections of a type of chondroprotective agent, like adequate. Seems to really help cats a lot, and they tolerate that pretty well. You can teach the clients to do that at home with a tiny little needle. It's not a lot of volume.
I used to do that, and then and it was fine for a long time. And then I had one cat that went diabetic. We were able to pull her out of it because I just used some corn silk and devil's club and stuff like that. Anyway, I pulled her out of the diabetes, but I kind of felt like she was on the borderline diabetic. And I think the Adequan, the timing of it, like that was the only side effect I ever saw from it. But it made me like a little bit, nervous about, even though I had done it for years with safety, and I've never seen that in a dog. And cats are just funny, but I did.
And CBD signals these different receptor groups in the brain, and it signals certain receptor groups that raise the seizure threshold and reduce inflammation. So, I mean, putting it simply, that's basically what it does. And the nervous system, our brain, central nervous system, peripheral nervous system, are loaded, have more receptors for cannabis type molecules than any other receptor system in the body. Now, we make our own molecules. We make our own bodies to THC. It's called anandamide. It's called the bliss molecule. And it's because our bodies have receptors for these molecules we make ourselves. And it's just the sheerest of coincidence, or maybe not, that cannabis has molecules that mimic the molecules in our own body, which is why cannabis has such a strong effect, because it affects this system. It's called the endocannabinoid system in the body. And THC, CBD, they both affect it in different ways, which is why you get different effects. You can actually get better effects when you have CBD and THC combined, because they give two different directions of pain relief, that sort of a thing. With seizures, we do see CBD tends to work, but it's the same. And this kind of is a good transition into dosing, because the one study that's been published in animals for seizures was in dogs with refractory epilepsy. That means they might be on 3 different strong, highly sedating pharmaceuticals and still have breakthrough seizures. They're walking zombies. It's a real tragedy for the family. It costs them a ton of money. These animals are zombies. They're not really present. And they still have the seizures. And it's pitiful to watch an animal seizure, and it's such a helpless feeling. So in the study that was done at CSU, they found that with a very high dosage of CBD, 2.5 milligrams of CBD for every kilogram of body weight twice daily, it's a huge amount, they were able to get control, some degree of control in 2/3 of the patients. Now, they weren't cessation of seizures, but it was longer intervals, less clusters, shorter duration. They could see it was moving in the right direction, and some were cleared completely of their seizures. They're redoing that study with a higher dosage at 4.5 mg per kg. Huge dosage. It's going to be very expensive. So my findings have been that not all dogs need that high a dosage, and cats, and the best way to address a patient with seizures or with any problem at all, dosing wise, is to start low. Start lower than you think they're going to need, because some animals actually respond to the low doses really well. And we see a biphasic dosing with CBD, which is that we see low doses actually work better for anxiety and high doses work better for pain. And you need to know where that cutoff is. Some people, they're not getting a good results on the anxiety, so they give a higher dosage. It might go out of that sweet spot where it's going to work on the receptors that deal with anxiety, and instead it's going to work on the receptors that deal with pain. So I start low. I start with maybe a quarter of a milligram per pound of body weight twice daily, dogs and cats both. And I do that for about a week, or two, to see if we get a result. We've seen with studies, it takes about 2 weeks for blood levels to develop a steady state for CBD. So that's why I say 10 days, 2 weeks, give it that long, see what it does. Maybe it's going to do what you want it to do. If it doesn't, double the dose safely, because studies have shown doses as high as 10 mg per kg to be safe.
So to review a few key points about cannabis use in pets, um, labels can be misleading, and it's good to call the company to get a certificate of analysis to find out the exact breakdown of CBD and THC, as well as some other cannabinoids. And, find out if there's any terpenes in there. There, like Dr. Silver talked about, myrcene, which helps pain by itself and can synergize the effect of CBD. Myrcene's common, or it can be found, it's a terpene or an active chemical in tops and in mango. It can take 2 weeks to get blood levels to activate those receptors that Dr. Silver talked about, and see improvement. So, don't give up right away. Try for 2 weeks, and like Dr. Silver talked about, we can increase the dose. He starts at a fourth of a milligram per pound of body weight for cats and dogs. CBD is good for anxiety, pain, seizures, and some certain cancers. There's a biphasic effect, low dose for anxiety and higher doses for pain. And I wanted to show you guys this case, just a little bit about it. I introed it in the beginning, but this is a dog named Nico. This is what healthcare could look like. Me doing acupuncture. We've already prescribed CBD and herbs for this dog, and he went from seizuring 5 times a day to not seizuring anymore, and lived into old age. So I guess I'm just saying, like, comment, share, tell your vets, there's an option.